Hey, what's up, everybody? Cam Hemphill here, your host of the Medical Millionaire Podcast. Thank you so much for taking the time to tune in. My goal is to give incredible value and insight for practice owners. So if you're looking to grow your practice, scale your practice, maybe even eventually sell, understand what it takes to run a practice like a business. We talk about mindset, we talk about finance, we talk about tech, marketing, tools, and also getting into conversations of wellness, peptides, GLP-1s, everything that's taking shape within the world of aesthetics. So today I have a phenomenal guest on, somebody that I wanted to have on for quite some time. He's out of the Fort Worth area, known as the Bougie Injector. He's the owner and founder of Bougie Aesthetics. I want to welcome Ryan Bourgeois to the show. Ryan, thank you so much for coming on, my man.
Thank you. Thanks for having me. I appreciate it. Looking forward to doing this with you.
Yeah, ever since the time that we connected, I know that this has been, time coming, and we've been chatting offline for a little bit. I want to know more about your origin, your story. Why aesthetics? How long have you been in the industry, and what really put you in a position to scale such a unique, phenomenal practice?
Yeah, no, I didn't mean to get into aesthetics. My background is 18 years of emergency medicine. There was an ER doctor that I worked with that was the medical director of a med spa. He said, "Hey, would you like to do injections at this med spa?" And I was always up for trying new things. So I went ahead and tried it. And it was kind of funny. The first thing I injected was like Xeomin. And then I had patients come back for a 2 week follow up visit. They looked like they took a 5 year nap. I was like, oh my gosh, what is this stuff? And then had somebody injected in me. And then I too looked like I had a 5 year nap. And then my wife was like, oh my gosh, what is this stuff? I need it too. So, and that's pretty much kind of how it started. And my background, even as a kid, I loved portraits. So I was an artist. I did pastels, etching, charcoal, lead, all those things. So to look at the face and from an artist standpoint, it came very natural to me. But I didn't know how to do it. And that's where I've gone and trained with the best of the world in order to do, pan-facial rejuvenation, mostly bioregeneratively is the way that I do it. And Bougie Aesthetics, of course, with your last name is Bourgeois. Why wouldn't you have a practice called Bougie Aesthetics? And I have been open for 5 years here in the downtown Fort Worth area for 3 years. And within the first 2 years, hit 1 million, only working 3 days a week. And that was a goal that I set for myself. And I was pretty happy with it that I was able to achieve that. And I did that through the trainings and investing in myself.
That's amazing, man. So 2 years, 3 days per week, and you got to $1 million a year in top line revenue, correct?
Correct. Yeah, yeah. I was working like 4 or 5 days a week, and then I was like, "Can I do this in three? Is this possible?" And then I did the math, and it was like 6,400 a day, 18 or 19,000 a week, and I think almost 90,000 a month. And then and then I just broke it. Wow. Okay. Um, you know. So, and I think I did that through mostly my befores and afters. I'm very aggressive
Mm-hmm.
on Instagram, proving my work. And I think that has a lot to do with it.
Yeah, I would absolutely agree. I mean, marketing is absolutely, it's just pivotal when it comes to the world of aesthetics. We have to know exactly what result we are going to see, right? So there's providers everywhere. There's practices everywhere. I think one could look through the lens of aesthetics and say, hey, it's commoditized at this point. Everybody's doing the same thing. And so how do you differentiate, right? How do you put yourself out there in the sense of having a crafty name, right? I think Bougie Aesthetics is amazing. It sticks, it lands, it has a brand behind it, right? Also showing your work online. So for the audience, you guys, this is a guy that started a practice 5 years ago, 3 days a week, took his practice to 1 million. And one thing that I really want to point out is you did the math behind it, right? And that shows that you had intention. You knew exactly what you were going into. Here's what I have to do per day. There's goal setting, there's strategy, there's marketing, there's showing your work, everything in that path. And so what were you doing? Because now it's full time, right? You're there every day.
Yeah. No,
What were you doing prior?
So 18 years of emergency medicine, like I said, and then I lived in Los Angeles for 13 years, and I moved out there after I became a nurse. I moved out to Hollywood to be a soap star, and I played on General Hospital from 2002 to 2011, and then I was also on Days of Our Lives on and off for a few years. It was fun. That industry just really wasn't for me. Acting wasn't my passion. I liked the art of it, but I didn't really like the people. So medicine has always been my love and always been my passion. And I'm just, yeah, I had to go back to medicine, and I got sick of living in California. Unfortunately, I got acclimated to the weather. So then I
Sure.
picked North Texas, right? So I'm from
Okay.
South Texas with a name like Bourgeois. Of course, you're in Louisiana border where it's hot and humid. So that's how I ended up in North Texas.
Gotcha. Okay, so when you went back to Texas, right, was your intent to say, okay, I'm going to get back into medicine because I want to get back into clinical practice, or I want to build a brand, or I want to do this correct, right? Because I know that in our discussions, you're very big on doing things the right way. You have intention behind education, right? You invest in yourself. You go train with world class providers, people that have been here for years. I want you to talk about that because look, in some states, some cases, some people think that they can go get take a couple hour course, and all of a sudden they become an injector. They throw some Instagram flair out there, and they think it's this get rich quick type of environment, and that's not the case, right? So you're a true walking inspiration in terms of investing in yourself, connecting with people that have done it before, taking their instruction and deploying it.
Yeah, the how I ended up, I was really worried about putting all of this filler in people's faces. I didn't think that it was. I personally just didn't like it. I didn't feel comfortable doing it. Not to mention, I'm 49 years old. My wife is 52. We've been doing this for about 5 to 7 years or so. And I don't want my wife looking strange. I don't want me looking strange. So I didn't feel comfortable. So I wanted to do everything bioregeneratively. And Sculptra and Radius were two of my favorite things. And I wanted to master both of those bioregenerative products. So, who is the best in the world at Radius? In my opinion, that is Yanni Van Lokum out of Amsterdam. I trained with Yanni roughly 2 to 3 times a year for about 3 years. And there was different techniques that I learned from him that I could only learn from him because nobody else here in the States could do. And then who goes through more sculpture than anybody in the world? That's Shino Bay. I also train with Shino Bay 2 to 3 times a year for like the last 3 to 4 years. And because of the trainings that I've done at UMA Academy in Amsterdam, I'm actually on faculty now in the Netherlands. So I go to Amsterdam or I actually teach with Yanni. The problem with a lot of these injectors is you're correct, Cameron. They're doing these weekend courses and they think they're just going to figure it out. Listen, man, there's techniques that I had taken me years to do in order to do a submasseter injection with the cannula, getting a cannula under the masseter muscle. That took me probably about 3 years to learn. There's a technique where I go back behind the orbicularis oculi muscle with the cannula, pop through the lateral orbital thickening, run the cannula down the periorbital rim on that palpebral malar groove, and lay radius. That took me years to learn. I learned that also from Yanni. I had to learn how to do foreheads. Nobody does foreheads. I've been doing foreheads for 5 years. That's one of the most dangerous areas in the face. So I had to go and also learn that from Yanni. And the problem with the injectors here is a lot of them is they just take this one course, and I know because they train with me. They come and train with me, and they train with me once. And I'm like, dude, you have to go to your practice. You've got to implement it. You got to figure out what the problems are. You need to come back to me, and then we need to go through it together. Because sometimes I have to grab their hand and I say, do you feel this pop? Do you feel this? Did you hear that click? You just popped through the gallia. Okay, that's an audible click that you know that you heard. So there's tactile feedback, there's audible sound. It's crazy to me that somebody just takes these weekend courses and then all of a sudden they call themselves like a master injector. It blows my mind. But yeah, but that's kind of how I've invested everything that I've made into myself.
I really appreciate the fact that you said that because I think it's interesting. There's a lot of misleading information, and anybody can go to their Instagram profile, Facebook profile, TikTok, whatever, and just put the word master or top 1% or top 100 or whatever this is, right? And what truly solidifies that, right? What gives you the ability to actually put that title? It's not because you had training one time, right? It's continuous education, continuous training. It's like going to the gym, man. Like if You can't just go to the gym once, meet with your trainer once, and then you know everything around the gym and nutrition and meal prep and all. You have to continuously meet with your coach, train with the elite, train with the best. Um, I love that, and you know what I think is going to happen. I mean, I already see it happening, but the patients and the clients, we have the ability to compare and contrast, and we can quickly identify this person's for real. This provider has taken their training serious. They have implemented techniques. They have met with the right individuals, and they have worked on themselves. You can stiff it out. Like I would say, a couple of years ago, it was a little bit more. It was more challenging to sniff that out. And now the fact that you show your work, that's the biggest thing. Because look, I'm a patient and I want to work with the best providers. I should probably go, see my provider more frequently than I do, but maybe we're all guilty of that. But I want to meet with somebody that's going to give me the result. I want the treatment plan, right?
Right.
I'm going to age every single day, and for whatever reason, I mean, I've had so many conversations with providers. It's they just need to put themselves in the mindset of the patient, and then deliver an outcome. Like all we want is an outcome, and we want advice. We want expertise. That's why we're here. That's why I'm going to pay you, a decent amount of cash in exchange for an outcome, a treatment, and an expert, right? And so you've done a phenomenal job of that. One thing I wanted to ask you about from more of the clinical side is because I've had a treatment where the cannula has gone in. I
Hmm.
wasn't looking in a mirror, but I had a buddy in the treatment room, and he was like, you don't even know what they're doing to your patient right now. It's intense,
Yeah,
dude.
but
Um,
green for sure.
yeah, but there's not too. I don't know too many injections. Okay, so through social media, through my network, sure, I know quite a few people that have the ability to do that technique. But here locally, where I am, if I wanted to go get some filler or talks, if I want to get fine lines and wrinkles, that I don't think any of them have the ability to conduct that sort of treatment or that sort of technique, right? And so, do people fly in to see you to do that, or?
Yeah, they do. Yeah, they really do. The other thing too that makes it, the way that I also address people's aging is, for an example, if someone comes in and says, "Hey, I'm 55 years old," I say,
Mhm.
"Okay, so at 55, I already know that your maxilla right here is recessed roughly about 7 millimeters. I know that your periorbital rim around your eye has already started to come out. I know that you had some of the mandibular retrusion. I know that you've lost 35% of your collagen. So I know that you've lost a lot of your deep fat. So I take into consideration the decade of life that you're in, and that's how I keep my patients looking like themselves. If you look at me in my 30s, I look very, very similar to the way that I look now. If you just saw me in my maybe 42, 43, to me, I looked a lot older. And it's just because I've put back what I've lost, right? And that's how I keep my patients looking like them. I'll use Sculptra down into those deep fat paths. Like a lot of trainers, they train Sculptra to go very superficial or very subdermal or deep dermal. I totally disagree. I feel like you need it when I'm injecting Sculptra. I'm into the deep piriform fat. I'm in the deep medial cheek fat. I'm in the deep lateral cheek fat. I'm in the deep mental fat. I'm in the zygomatic fat. So I'm targeting the deep fat pockets that you have actually lost. You do not lose superficial fat as you get older. You lose deep fat, and the superficial fat starts to drop, which is why every 50-year-old comes in my office and goes, "What the hell is this?" And they're pulling at their jowl. And that's because the inferior jowl compartment of the superficial fat pads has actually dropped down. So I look at the face like that. It's not about you coming into my office and you going, "I don't like this, I don't like that." This is not really a menu, so to speak. It is, you get about a 10-minute presentation from me when you come into my office. I say, "Hey, it's so
Okay.
nice to meet you. Let's get to know one another. I want you to understand what is going on with you." Because you're going to say, "Hey, Ryan, I don't like this, I don't like that." And I want you to know what's happening. And so once they see, I show them skulls. I show them a skull that's age 20. I show them one that's age 50. I show them one that's age 80. I show how the skull changes over time. Um, and I show them the actual fat packet, the fat pads and the pockets in their face, and how they should. So
Hmm.
I explain that to them so they know the why. Because in the consultation process, I mean, told you this, Cameron. Back in the day, we used to take our pictures and we would put them up on a TV. So in my office, their pictures go up on the big screen. I used to
Mhm.
do that. I used to put their picture on the TV and I would go through it and I would be like, hey, let's fix this. I see this changing here. Let's do that. And I see this. Hey, let's do that. Man, I've had some girls cry in the office because of
Oh,
that, and I was like, okay, there's got to be a better way in the consultation process not to hurt a female's feelings or anyone's feelings. And that's when I said, hey, okay, we are all in this boat together. We're all going to age. How can I help them see it the way that I see it? So then medically, I would throw it up and then they would see it. And then now I'm not the bad guy. Now I'm not going, well, I can see the dark under your eyes. Or, well, yeah, I can see the nasolabial flaw. I can see your fat. And now I'm not calling out every single insecurity that they have. I'm saying, here's the
yeah,
reason that you're seeing what you're seeing. And these are the answers that and the treatment that you need in order to fix it. And it's a multi-layered approach. It's not one smoking gun where you go, well, I've been having Botox. Well, unfortunately, there's a lot more going on than just wrinkles. So, but yeah, that's why a lot of people do fly into me to. We have celebrities, so we're here in Fort Worth. We have celebrities
yeah.
from Tyler Sheridan's Lioness and Landman that come in to see me. So, and that's because they're scared. They don't want to look all puffy and they want to look natural. And people
Yeah.
ask me all the time, hey, because we got celebrities come in here, they go and they work with them. They go, how does such and such all of a sudden look crazy? Like, what happened to her? Why does she look like that? Well, what happened was, I hate to say it, but a lot of the problem is the pharmaceutical companies. The pharmaceutical companies come to a practice like mine, and they go, because you say, let's just say I just opened up my practice, and I call Allergan, Galderma,
Hmm.
and I say, I want to learn how to inject filler or I want to teach me how to inject. Then they bring someone to my office and they teach me FDA approval. Well, they've got a filler for the jawline, the cheek, the nasolabial fold, the under eyes, the lips. I mean, it's ridiculous. But that's not the problem. We're not losing filler in our face. We're losing bone, collagen, and fat. So, and that's why I was very reluctant to start pumping faces full of a bunch of filler and by using Sculptra, Radiesse, Biofiller, and using hyaluronic acid filler very judiciously. Because it's still a great tool, it's still a great product. But to me, but that's how people start looking weird. It's an accumulated factor because they'll go, well, I got 2 syringes in my cheeks, and then next year it starts to drop, and they go, well, hey, let's get another 2 syringes in my cheeks, and then a whole another couple of years go by. Well, let's get another 3 or 4 syringes in my cheeks. That filler does not go away. New studies have shown that it's staying in the face 5, 10, 15, 20 years. My wife has had probably 15 to 20 vials of Sculptra in her face. And you can go look at my Instagram because I just did a post on my wife and you can take a look at her. She looks beautiful. She looks so natural. And she has been pumped full of Sculptra. And me, same thing. I've had probably 6 to 10 vials of Sculptra. I've probably had 10 or 15 syringes of Radiesse.
Hmm.
But I still look like me. You know what I mean? So, and no one can tell that anything was ever done. And, they say the best injectable is undetectable.
I love that. I'm looking at your Instagram right now. I think it was a post that you put up in February, a picture of you and her. I mean, you guys look so young. You said you're 49.
Yeah. Tomorrow's my
Wow.
birthday.
All right, brother. Happy birthday, man. No,
Thank you.
you look incredible, and I love that it's this natural look. Just the way that you're talking and go about it, I mean, makes it just a completely different approach in the sense of. I mean, I bet your Sculptra to filler injection ratio. I'm curious to know what that is. Right? Is
Super.
it
Yeah.
okay?
I'll,
Yeah,
I'll
super
pump
high.
through Sculptra. I mean, the Galderma reps, they laugh because I'll buy filler and it just stays on the shelf for, I don't know how long. But I'd still do it because I do frontoplasties. I do a lot of foreheads.
Sure.
I do noses and, of course, lips. And and some people are on like GLP-1s and they don't eat enough. They don't eat enough protein. I mean,
Yep.
you can't build collagen if you don't consume collagen. So if they're like, well, I'm on the GLP-1 and I don't really eat much, and I'm like, well, congratulations, you're getting filler in your face. Because the sculpture's not going to work that good. you
It's
know.
the only
So
path. Yeah, it's the only path, right? I mean, that's it. Well, so let me ask you a question because I'm bald, right? I always wear a hat, and that's just like my signature style. But when I have gone to see multiple injectors, if you look at my head, and I was to lift my eyes, I always have the wrinkles right there. Well, every time they inject, it's Botox or some sort of other neurotoxin. It seems to always bring some of a bulge up at the very top. It's like I always tell them, I'm like, I think I got a five head. So is that because you mentioned injecting in the forehead is you have to have the right technique. You have to do it correctly. It's actually an interesting area to inject. For me, from a patient standpoint, it seems pretty straightforward. But from a clinical practitioner standpoint, you obviously have way more deep expertise than me. Why is it why is it every time I have gone to see an injector, I can never get the result that I'm looking for? Is that because it's filler? Is that because it's a neurotoxin? They're not injecting the right spot? I mean, what is it?
yeah, you're actually spot on. You're right. So this is the one of the tricky things with guys. So I see a lot of guys, and
Hmm.
especially if they have a shaved head, people don't realize it, but the muscle really goes way back here. So if they're trained to inject here and here, and then you get these little wrinkles. Is that what's happening? Are you getting like
Yep,
these little?
yep, yep. I think so.
Exactly.
Yeah.
So they're not going back far enough to where the actual movement of the muscle is. And that's why if any of my patients have seen me, they know I drive them crazy. I'm like, raise your eyebrows, raise your eyebrows, raise your eyebrows, raise your eyebrows. I'm saying it over and over and over and over because I'm like, okay, there's a spot. All right, there's another spot. There's a spot. And I'm making damn sure that when you come back for your 2 week follow up visit, that there's no touch ups. Because if there's a touch up, it's on me. I don't charge for touch ups. You know,
Okay.
and that's another thing for you that I recommend, that make sure that you are going back for a 2 week follow up, because that could be the thing that you may not be communicating with your provider going, hey, every time I get injected, when I raise my eyebrows, I see this one little
Hmm.
thing up here at the top, and they will be like, oh yeah, let's hit that real quick. Or maybe they're just young and maybe they just don't know because they just think they're supposed to inject here,
Yeah.
but I think
Yeah.
it's just my experience with injecting so many men. I think that's why I know that.
Yeah. It's almost like they have to get into the actual scalp more,
Oh,
right?
you do,
And
you do. Yeah, you damn near almost have to get into the hair on some people.
yeah,
Like if you
yeah,
watch when you watch women. Yeah,
yeah. Interesting. Okay. Well, you mentioned something interesting there because again, I've gone to see providers. I've had some providers. I always try to analyze how really the treatment plan goes, how the consultation goes.
Mhm.
And I've had some that have gone great. They have built a treatment plan. We have had conversations of really, why are you here, Cam? Like, they've some have gotten to the point to where they've gotten to the emotional root, right? Uh, Others are very surfacey. They'll look at you and they'll say, okay, hey, I think we're going to do this, poke here, do this, do this. It's just very transactional,
Yeah,
right? Where, look, I think if I think that practitioners need to do a better job of building rapport, building relationships, and building a treatment plan. Not because I want to see you back in all the time. It's because we're aging, we have to build a relationship. And yeah, I do want an outcome, right? So talk to me about, what is your process from someone comes in, you have the consultation, you put them on a treatment plan, they obviously come back in 2 weeks for touch up. Like, what does that look like? How many times are these patients seeing you on a yearly basis?
yeah. So when it comes to neurotoxin, well, let's say they're in their 20s. Okay, so let's say they're in their 20s, right? So everybody falls under three categories. It's beautification, preservation, restoration. All right, so they are under a preservation, maybe even a beautification when you're in your 20s. Their biggest complaint is, hey, what the hell is this wrinkle? And you're like, oh, I can stop the muscle from making the wrinkle, not a problem. So that's one of those things where I may see you once a year. I may see you maybe twice a year. I don't really need to see you that much, to be honest with you. You're super young. If you do like your brow lifted up, then I will see you. If you do like the brow lift, then maybe come back and see me in a few months, and we can keep that lifted. So I don't really see 20-year-olds very often unless they want to come see chemical pills or do microneedling or stuff like that.
Sure.
That's great. They can definitely do that. When you're in your 30s, they may be getting Sculptra. They may be getting Sculptra. Like if they're in their early 30s, they can get one treatment, and it may last them a few years, unless they lose weight. Like, and then when and their toxin's probably going to be about maybe 2 to 3 times a year. And then it just depends on what some of their complaints are. Unfortunately, the higher the decade of life that you're in, the fourth and fifth decade, I'm going to be seeing you more. Unfortunately, I just did a post on my Instagram of me being damn near 50 and what I have to go through, and I literally go through like 2 vials of Sculptra, 3 syringes of Radius, a whole kit of Easy Gel. I get neurotoxin 3 times a year, and that's not even talking skincare and laser stuff. You know what I mean? So the older you get, unfortunately, the more expensive it becomes.
Yeah.
And it all depends on the degree of the person and how they want to be treated. Everybody has the right to age however they want. And I don't try to push that on them. I let them know, hey, do you want to look 5 years younger? Do you want to look 10 years younger? There's a possibility I may be able to get you 15. I can't do that for everybody. And you just you see them that one time, you have them come back in a couple of weeks for a follow up, and at that follow up you start to talk about, could they use Sculptra? Is there, hey, I saw this thing on Instagram, and I don't, it just maybe they wanted they wanted a little contour on their cheeks, or
Hmm.
maybe they wanted their jawline a little sharper, or maybe they want their nose straightened. um, it just depends. It's kind of hard to really say like everybody as a systematic, I see you in 2 weeks, I see you in 3 months, and just kind of have that rhythmic motion. Honestly, the longer that I've been treating the person, kind of like how I've been treating myself, and the more I get to know them, the better I know their routine. And the better they know their routine, and the better they know how much it's going to cost them. And that's a whole nother thing, right? So there's people that a budget isn't an issue. I've got a lady, I mean, oh my God, her befores and after. She's one of my very first posts on Instagram. And it's like there's 5 photos of her, and it's literally not even, I don't think it's a year, and how much she changed. She refused to have a facelift, refused. And I was like, wow, okay. And she didn't care how much it cost her. I mean, she was in here nonstop. Boy, it got to the point to where I reached my max. I was like, listen, I can't go any further. I mean, she looks about 15 years younger. I said, I've capped out. I need you to go do lasers and do stuff with Trish, our esthetician now. Um, yeah, it depends on the person. And I've got some women that come in that go, I had a woman that came in at like 53, 54 years old. I mean, I could have done $10,000 worth of work on her, but she was
Hmm.
only concerned about the lines in her forehead and then the 11 lines. That was it. So,
So,
and I told her so, and I treated her. Oh my God, she loved it. And I'm going, and I know damn well she could use 6, 8 vials of Sculptra and everything else. But I can read her, and I can tell she's happy with this. And I'm like, listen, if you want to go further with this, you just let me know. And I tell them, I was like, you have the age, you have the right to age however you want. Just know I can knock another 10 years off of you. It's not going to be cheap. But yeah, it's a great question. It's a very good question. It's a big struggle, and I think that's how you also make it where it's not. I think it's how it's not transactional as well. Um, and just, I don't know. And another thing that I see is when you're talking transactional, I know a lot of providers that have Botox appointments that are 15 minutes. I
yep.
think that's ridiculous. That's ridiculous. Okay, every patient that I see gets at least 30 minutes, and then my consultation with injection is an hour and a half. Sometimes my full face work is 2 hours. And it's
Wow.
nothing. And so if you, I say, hey Ryan, what is your highest day all by yourself? I've hit 20 grand. I hit $20,000 in a day. And that was only, and I only think I saw like maybe 5 or 6 people. But when you're doing full face work like that, when you're going through the entire face, when I do a consultation process, when I do that, after I do that speech, that 10-minute speech, I take their pictures. They go up on the big screen. When they go up onto the big screen, I say, just sit there. I'm about to draw all over your face. And I do. So they watch me. They watch me chart every single thing. Like I'm drawing circles and fat pads, and I'm putting where I'm going to do the Botox injections. They know everything, and everything's color coordinated. So whenever I said, listen, I said, just sit there and enjoy the show, and I said, we'll go over this in a minute. And then whenever we get done, I go to the TV and I say, all right, let's go through this. And I'm like, you remember the presentation? You remember the fat patch? You remember the structural changes that you're having with your bone? You remember the collagen that you're losing? All right, let's go back over this. And then I literally go, these are the areas that we're going to target, and this is why. And I'm like, okay, this right here, this multi-point technique with Sculptra, that's going to cost 1,900. Your temporal brow lift that I do with Sculptra, that's going to cost you 2,000. Your full face toxin, that's going to cost you $1,000. We're going to do your lips, that's going to cost 450. I think you could use some easy gel in your under eyes. That's going to be like 1250. And I will literally try to get to about a $5,000 to $7,000 range. And
Hmm.
I listen, I'm not expecting you to do this all today. I'm just telling you what I see and what I recommend, and we can go and do this by, by chunks. If you have to, a lot of times, more than not, they pull the trigger right then and there, and I'm like, okay, all right, let's get to work. This is gonna take a minute, So, but yeah, I mean, I did that on a girl. I did that, I think, a few days ago on Saturday, and I had like an $8,500 ticket, and I had another $5,500 ticket. They said, screw it, let's just do it all. Because you are really only doing that maybe once a year, maybe
Sure.
once, twice a year, if that. So I do my major work, and my major work's probably 4 to 5 thousand if I was to pay for it, and I do that twice a year. The neurotoxin's roughly around 1,000 or whatever, a few times. So I'm also make it look like that, and I'm like, if you do Cherry, if you use Patient Fi, if you do a monthly payment, it's really not that much. And if your face isn't worth it, then I mean, I don't know what to tell you, because you want to look,
uh,
but
I
no.
love it, man. I mean, you're an artist, dude. You're a true artist. I mean, you're taking the time to actually have the conversation, do it correctly, show them on the screen, draw it all up, and then put them in a position to make a decision, right? I like that you say, everybody has the right to age at their path, right? And it's true. I really like. I've never heard anybody say that. I love that, and I really think that you're doing something in the consultation room that's it's outside of the norm, which fortunate or unfortunate, you're doing it correctly. Like you are saying, hey, you're going to spend time. I know if I was to come see you, we're going to spend a half hour together in a consultation. You're going to take pictures, put it up on a screen, draw all over. You have the anatomy background, you have the education, you have met and trained with the individuals that have done this the right way. And for me, I just look at it like so for the audience, right? This is a testament of a artist that is spending quality time with his patient, understanding the root problem, spending time with them, and putting them in a position for them to make a decision. And it doesn't have to go down in one chunk, like you said. They could take it down in tranches over a course of time. There's obviously patient fi, there's Cherry, there's other avenues that they could use to finance it. But it doesn't surprise me that your average ticket is it's well above benchmark, Ryan. It's like way above benchmark. The average ticket in aesthetics right now is right around $540,
Oh yeah,
right? So like you're like 10x that,
yeah.
way higher than that. But the difference is look, I see injectors that are seeing 15, 20 patients a day, and then they have to do charting. They're running around like crazy. Sure, they're doing lots of volume, and maybe the day goes by fast, but they're exhausted, and there's no way they're getting that quality time with that patient. And again, talking about transformation, talking about outcomes, uh, we as the patient are okay spending more money to get the right result and meet with the right provider. Yeah, I'm going to spend the money either way. I'm either going to spend it by traveling to go see the practitioner several times a year, right? I'm not going to get the result I'm looking for. So you're going to spend it either way. You're either going to spend it on time or money, or you're just going to knock it out and see the right provider. So I'm a big fan of doing it correctly, and it's just reassuring to hear you talk this way. I love it.
Yeah, and that's and it's I know we talked about a little bit this not on the outside of here, but hitting the 5 year mark, we hit the two. I hit a 2 million cap. I hit that 2 million, and I had to hire Dan Martell, the business coach, in order to buy back my time, which is his book, that he wrote. And I've just started to implement that, and I've been with him for a couple of months, and it's been life changing for me. And that's what's been happening. So that's another thing we probably ought to cover is that business
Yeah.
owners are starting to feel that pressure. of the time. When you're talking about seeing 15 patients a day, well, I cut that down to maybe 5 or 6. But I'm still doing the amount of money, but I still have to chart and I still have to spend time with them, and it still does drain me. And you still have all this administrative stuff that you do. But yeah, I got to the point to where, um, I almost did sell the practice. He tells, Dan Martell says you either going to you're either going to sabotage yourself, you're going to sell your practice, or you're going to stall. There's three S's, and you're going to do one of them. And I literally, I hit two of them well, I probably hit all three, to be honest with you, because I came very close to selling. And then self sabotage by buying a bunch of machines, lasers. That was a huge, that was a whole nother discussion we can have. Making bad choices. And then I just stalled because I had this cap, and he calls it the pain line. You hit this pain line where you just can't take it anymore. If anybody out there is feeling this pain, I highly recommend definitely purchase his book, Buy Back Your Time. Look up Dan Martell. He is absolutely phenomenal. You need to get a business coach, just like I became one of the best injectors in the world by learning from the best in the world. Now I'm having to learn how to be a business owner by one of the best business owners in the world. So if you don't see the common denominator here is
Yeah.
find out who the hell is the best. You pay them and learn from them in order for you to leverage yourself.
I love it. It's one of the best books I've ever read. I know that you and I were talking about it offline. I hit multiple pain lines. I'm an entrepreneur. I build companies. I've sold companies, and I've been on a great path in terms of building a tech company and a marketing agency in aesthetics. And in fact, it was the largest marketing agency and marketing automation company in aesthetics. And I built that up. I almost sold it 3 years early because what happens is you get to the point where you just become the administrator
Mhm.
and you start doing all the admin tasks and you forget your why of why you're actually here, right? And burnout's real. So, like you said, self sabotage. You don't fire yourself from activities that you should be delegating. That was the biggest one for me.
Yeah.
Is like being an entrepreneur, being a control freak. You want to hold on to everything. I can do it. I can do it. I can do it. It's like, dude, there's more to life than just like charting and doing the books for your business and posting on Instagram. You can actually hire resources, and sure, it may lower your EBITDA, but at the same time, you keep buying your time back. It gives you the ability to work on your technique, to work on the business, to work on your patients, and ultimately, everything comes back up to rise. So, I completely agree. Great book, great guy. Definitely follow him on Instagram.
Yeah, it was definitely keep you weren't keeping the main thing, as he would say.
Yeah. Hmm.
Is and for me the main thing is spending time with patients, making them feel great, and working on them and having that time and not getting pulled with all this administrative stuff. And it does. He knew immediately when he was texting me back and forth, and we talked. He was like, "Where are you at money wise? How many staff members do you have?" And he's like a freaking business whisperer. He goes, "Oh, I know you're in the weeds." Yeah.
Yeah.
So and I was. I mean, I literally was about to lose it. I just all of a sudden I just implemented everything that he is saying. I hired a practice manager, handing over my inbox, handing over my calendar. It actually made me a better husband. It's made me a better father. It's taught me how to carve out time for my family. It's like, because, I used to stay here till 8 or 9 o'clock at night. And it's like, you don't do that. Like at 5 p.m. or 6 p.m., whatever the time you get off, you need to get the hell out of here and you need to go home to your family and you need to spend time with them. You're not going to look back at your life and go, man, I sure do wish I'd have worked harder. Nobody ever says that, so, and you just do better the next day. You just do better the next day. Write the things down and go to the next day and move it over. Like just, because you could stay here till midnight every night doing work, but it's just not worth it.
It's not. I totally agree. I mean, you have to have roles. You have to have deadlines. You have to have self discipline. And truly, I mean, it's you're so right. It's my wife always teased me. She's like, you're really good at email. I just want you to know that. And I hope that's not what you say in your deathbed or somebody says it before you. I'm like, yeah, Kev was really good at email. Hell yeah. So no, I agree. I mean, it's there's one way to scale a business. It's the right way. Entrepreneurship is extremely hard. And what happens, I think it's the last person standing. You either give up, you self sabotage, you sell in some cases, especially if you're just completely burnt out, you're going to sell for a discount, right? Because you just want to get out. And really, the entire intent and purpose is to build an asset that's going to continue to reward you, right? And if you continue to honor that asset, double down on it, educate on it, hire the right people, have the right finances, study the right courses, bring in the right educators, your business anchors with strength. And that's the important piece. And, look, in business, whether it's aesthetics, med spa, wellness clinic, car wash, I don't care what it is, there's an expiration date. There always is. We're going to continue to age, even though in the beautiful world of aesthetics, we may look a little bit better as we age in this world. Um, but retirement does take place, right? Like there's an expiration date. And I'm a big believer that if you choose to quit at some point, expire, right? Choose to say, look, okay, I've ran this for 20, 30, 40 years. You're either going to hand it down to an heir or you can go trade it. And if you have enough enterprise value and enough EBITDA and you've built a practice with strength and anchored with philosophy and have a wonderful team and culture and finance all around you. I mean, I have seen practices trade just recently, ones that are doing 3 to 4 million in EBITDA. I've seen them trade for $30 million.
Wow.
That's a lot of cash,
Yeah.
And what can you do with that? Well, you can give back, you can invest, philanthropy, you can build a passive income, but it's hard to get to that point. Like the average practice is obviously doing south of 1 million, but it's really hard for people to break through that 2, 3, 4 million. Really, really hard because the provider is the one that's doing most of the work, and so you have to outsource a tremendous amount of administrative tasks in order to keep growing.
Yeah, and there's another book that I'm going to read after his that I'm almost finished with. It's called Die with Zero, and
Uh,
it's like live your life absolutely. I mean, you die with zero, and it's like you talk to Dan. Dan's like, I'll never retire. It's not going to happen. I am gonna give back. I'm gonna talk to kids. I'm gonna, what am I gonna, what else are you gonna do? You're just gonna sit with the money, And there was a part of me that was like, sell the company, move off into the woods, and don't do this every. But I mean, would you
yeah.
truly be happy? I mean, would you really be happy? I don't think that you would. Like, you're gonna want to, and then how that's not a lot of meaning to your life. Like, it's just how do and then I get a lot of slack. So I've got some friends in this industry that have PhDs that are always publishing, and they give me shit big time. Like, hey, you need to be publishing what you're doing. Like, I don't see anybody that gets before and after results like you do. You need to tell people and show people and publish exactly what you're doing, which now that I'm learning how to buy back my time, I'm learning to have the time to actually start working on publishing. Because what is the mark that you're going to leave in this industry? Right? And people are going to learn from you. People are going to cite your stuff and go, and that's how you make a difference in this industry. And it's just us proving what we do because everybody's in their office acting like a mad scientist doing all this stuff. But if you don't put it out in the world and publish it, nobody even knows, what you can do. So
I love that you brought that up. I haven't heard anybody say that either, because it's not about the patient, but what's the legacy you lead and leave with your colleagues, right? If you publish it out there, somebody can then take your publication, read it, pass it to their patients. You're leaving legacy,
mhm.
and then they can put their own spin on it, right? They can put their technique on it, advances come, all that stuff takes place. I love that. Well, man, I really enjoyed having you on, and I know you're super busy. I know you have patients to see. I know you have books to read, coaches to talk to, publications to get to.
um,
But
it doesn't stop. But then, hey, die with zero, man. Keep going.
die with zero, baby.
Just
I
keep
love
going.
it. Yeah. Well, hey, man, where can people connect with you? I know that there's going to be a lot of people that tune into this particular episode. They're going to want to connect with you. What's the best place?
Yeah, I mean, well, now that we have a practice manager, getting a hold of her, is the best thing. And you can set up if you want to do any Through Bougie Aesthetics, our number is 817-229-0014. We do have an Instagram. It's Bougie Aesthetics. But yeah, you can get a hold of our practice manager, and she will actually set that up. If you want to shadow, if you want to train, if you need me to fly out to train you, I do that too. So, but yeah, and it just depends on what you're learning, what you want to learn. Obviously, I think the biggest gap right now, as you said before, is consultation process. I've had a lot of people reach out to me and go, "Hey, I'm really having a struggle with the consult," and it's probably the hardest thing. Nobody wants to talk about money. It's a touchy subject, but and then people don't want to talk about other people's flaws and what they need. Um,
Yep.
but yeah,
Yeah.
yeah, getting
I
hold
think
of
if you did something on it, the consultation process. I mean, you have a unique position on that, and because it's such a struggle for these providers. It's like it's uncomfortable. They feel like it's being salesy. Really, it's no. You're giving information and education. They have a hard time looking past that. They think that there's a ceiling cap on everybody's credit card or financial status or whatever, and then they don't know, right? They haven't looked at the bank account. They don't know. Um, but yeah, I think that there's a ton of opportunity. In fact, we should talk offline. I think that there's some things we could do together there.
Yeah, definitely.
Well,
Looking at it
man,
as, but to look at it as assess, diagnose, and treat, right? It's what medicine is all about. You assess their face, you diagnose the aging process, and then you come up with a treatment plan. If you really keep it that simple and you know exactly how they've changed and how to address those changes, you're not going to go wrong.
yeah, that sounds exactly what a provider should be doing. Yeah,
Should
so,
be, but a lot of times
yeah.
it's like it's not that. It's a damn salon. It's like, yeah, I'll take a cheeks and a lips and a nose and a. Are you kidding me? Like it's
Oh,
just
yeah.
yeah.
No way. Yeah. Okay. Well, I'll leave it at that, guys. If you found this particular episode valuable, please share it. That's my only ask. Share it, rate it. I'm sure there's a colleague out there that would love to tune into it. Go connect with Ryan. Go follow them on Instagram, Bougie Aesthetics. They're out of Fort Worth. He gave his phone number. And of course, we'll do some tagging as well and make sure that we put this stuff out there. So, Ryan, thank you so much for joining. And I'll leave it at that. Until
Yeah,
next time,
get it.
happy injecting.
Thank you.